Hello, I'm Amy Hollingworth, the director of the Safe Sports Network. I'm here today with Dr. Wasfy talking about sports cardiology and the athlete's heart. So thank you, Dr. Wasfy, for being with us today. Dr. Wasfy, can you tell me what an important take-home point regarding sports cardiology and the athlete heart would be for healthcare providers?
Definitely. And so I think one thing to recognize is that exercise impacts the whole body, including the heart. And time and time again, as we look at big population of athletes, we see that their hearts look different than people who are inactive. Largely it's that the cardiac chambers enlarge, and they can enlarge in different ways depending on which sport the athlete plays. And then there's other changes as well, like lower resting heart rate. And so take-home point would be is to almost expect that an athlete's heart, as you might find either on physical exam, EKG, or if you're doing heart imaging, is going to look slightly different than a sedentary person's heart. But there's a range of changes, and so the hard part comes in defining how different is acceptable. And so though some degree of cardiac enlargement may be expected in athletes, sometimes it borders on, the heart can be so enlarged or so thickened that it borders on making us concerned that the person might actually have a heart disease, such as things like hypertrophic cardiomyopathy, a dilated cardiomyopathy, an arrhythmogenic right ventricular cardiomyopathy. And so these gray zone cases, oftentimes require a lot of effort and specialist care just to really get to the bottom of whether what we're seeing is just physiologic, healthy cardiac enlargement due to exercise, or whether it's sort of the early beginning signs of a cardiac condition. The reason it's so important to figure it out is because, of course, those conditions I mentioned are among the most common structural causes of sudden cardiac death and arrest, and so getting the answer correct in the end has really huge implications.
Excellent. And in regards to the athlete heart itself, you mentioned there's changes based on different sports that they may play. Mm-hmm. Do those changes reverse, or do you see a change if they were, per se, a rower at one point? Does 5 years later, 10 years later, does that change go back?
That's actually a great question, and it actually ties right back to the clinical point I was making. So the short answer is we don't really know exactly yet. We were talking about how there's some cases sort of in this gray zone where we actually don't know whether the person has heart disease or just a normal athlete's heart. And because there's cases that get to the point where we've done every heart test in the book and we still don't know the answer, one thing that we can do clinically is tell the athlete to stop exercising for a period of time, usually 3 months or 6 months, and then see if it's athlete's heart, then to some extent some of those changes should go back to normal, right? Because they're not exercising anymore. And if it's a heart condition, you would presume the heart muscle thickening or enlargement would stay the same because it's not due to the exercise. But that's something called detraining. We rarely use it in clinical practice, and one of the reasons is, though it seems like it might be a good idea, is that we don't even actually understand the time course of sort of how long does it take to build up a larger heart muscle or enlarged heart cavity, and how long does it take it to go away. So our group is working on this, but we're really in the early stages of defining how quickly those changes can reverse, or if someone switches sports, for example. And so we need more work in that in order to be able to understand what's normal, and then also understand when we're applying that clinically to patients where we're not sure what the answer is, what to expect.
Excellent. What would you say is the biggest buzz around sports cardiology and the athlete heart at this point?
That's a great question. I think one thing that has sort of brought up a lot of debate is sort of the question of how much is too much. And so, we think of exercise as being very healthy, and as I mentioned, it causes all these sort of physiologic adaptations in the heart in the acute period. But whether over prolonged periods of time, high doses, particularly of endurance exercise, might actually have deleterious effects on the heart has really become a hot topic, and a subject of a lot of debate as well as research. And if there's sort of a big three, I would say that out there it's been proposed, but yet not yet proven, that high doses of exercise over decades and decades of time may make people predisposed to having sort of scar form on the heart, increased risk of coronary plaques and coronary artery disease, and then increased risk of heart arrhythmias, including atrial fibrillation. The atrial fibrillation piece has been relatively well proven over time, and it does seem endurance athletes a long time have sort of 3 to 5 times increased risk of AFib as compared to normally active individuals. The other two, though, whether athletes sort of can develop a scar on the heart from sort of overuse, or whether exercise can make coronary plaques more likely to form, are really still topics of great debate. There's been some studies that suggest these might be true processes that occur, but we don't yet really know for sure. And then also we don't know whether those scar and those increased cardiac plaques actually lead to worse outcomes. So whether that leads to things like heart attack and arrhythmias and sudden death. So that'll be, I think, a real promising area of research in the next couple decades.
Excellent. Very interesting.
Yeah.
One more question. As you know, working with athletes, they can be pretty in tune to their body and maybe feel palpitations or things that non-athletes may just go through in their day or whatnot. Is there any correlation between, asymptomatic feelings of palpitations that maybe then lead to something more down the road?
Yeah, palpitations are a really common cause of concern in our athletic population. And I guess I'd always still encourage people to get things checked out, because the cause of palpitations can range from conditions that are entirely benign all the way up through very dangerous conditions. And so the most common cause of palpitations are just extra heartbeats, and so that either from the top chambers, the atria or the ventricles, so PACs or PVCs, they sneak in between normal heartbeats, and man, they can drive people crazy, but they're totally benign as long as your heart is normal structurally otherwise. So though you could take medicines to feel better if they're driving you crazy, they don't really require any medical intervention and largely just reassurance. In the middle, I'd say, is the diagnosis of atrial fibrillation, which is a common cause of heart palpitations that are sort of more sustained, lasting not just for a second at a time, but for more like minutes or hours or days. Atrial fibrillation is not an inherently dangerous condition, besides the fact it poses some stroke risk, and so you can control that by using blood thinners, and then we use medicines and procedures as needed to help deal with patients' symptoms. So it's not a condition where we just reassure someone, so it's important to make to distinguish between that and just PACs and PVCs. And then more rarely, but palpitations can be due to dangerous heart arrhythmias, such as something like ventricular tachycardia, that inherently could be dangerous and definitely requires more treatment and not just reassurance. And so I'd encourage people who have palpitations to get it checked out, regardless of whether they're an athlete or non-athlete, in order to be able to tell what it's due to.
Regardless of whether they have symptoms or not with them.
Yeah. So I think of palpitation as being the symptom itself, and so so if they're having symptoms, they should certainly get checked out. If they've had something found incidentally on an exam or another heart test, then still getting input either from your primary care or a specialist about whether that's something to be worried about or not is a wise choice.
Excellent. Well, thank you very much for your time,
Yes.
Dr. Wasfy, and have a great day.
Oh, you're welcome. Thank you.